All right, folks are starting to let us know. So we got Western New York, we have Alabama, Norfolk, Virginia, near my alma mater, Frankfurt, New York, DC. Look at that. Rockville, two Rockvilles. Oh my gosh, love it. All right, well, as folks are introducing themselves, again, if you're just joining, let us know your name, the name of your business, and where in the world you are dialing in from, so we can get the presentation started. We're thrilled to have just a fantastic group of presenters today to talk a little bit more about Medicare, and what it means to your business. Know that we do have opportunity for question and answer. So if you look at the bottom of your screen, you should see a Q&A button. You can use that Q&A button at any time to ask questions. We'll have time at the end to look at those, and we encourage you to do so because we know that there can be Medicare can often elicit a lot of questions, and we want to have opportunity for you to do that. And secondly, this session is being recorded, so we will share it out afterwards via email, so you can review it or share it with other folks in your network. And with that, it's my pleasure and honor to turn it over to Xavier Vaughn, Program Manager of Medicare Education at AARP. We're also joined by Maggie Flowers, SHIP and MIPA Manager with the Administration for Community Living. Maggie will jump on a little bit later to talk about some of the resources that SHIP and ACL have. But in the meantime, passing the mic over to Xavier to really kick us off. Xavier, over to you.
Okay. Thank you, Colin. Let's see. Okay. So our agenda for today, we're going to go over some Medicare basics, educating your employees on Medicare, and different resources and tools that are available to you. So some of the common questions that we may get pertaining to Medicare is, what is Medicare? What's covered? What's the difference between Medicare and Medicaid? When should I enroll in Medicare? If I don't enroll when I'm supposed to, and how will Medicare work with my existing healthcare needs and insurance? So what is your role as the business owner? Your role is to provide Medicare-eligible employees with educational materials about Medicare, connect employees with unbiased resources, and help Medicare-eligible employees enroll into the program. So what is Medicare? That is a good question. So Medicare is a federal health insurance program that is eligible for people who are 65 and up. If you're under the age of 65, if you qualify for disabilities, anyone with end-stage renal disease, and if you have ALS as well. If you are 65 and up and you are already collecting your Social Security, then that will be an automatic enrollment into the program. If you are on Medicare due to a disability, that 25th month, you will automatically be enrolled into Medicare. And then with end-stage renal disease and ALS, you do have to certify that you do have those elements, and so in order to qualify, but you would just go to Social Security and do the application. Okay, so what are your employee responsibilities? Well, your employee responsibilities are going to be the same as they currently are with the employer-sponsored healthcare coverage. You're still going to have the monthly premiums, the deductible, the co-insurance, and co-payments, just like you would in regular health insurance through your employer or through the marketplace. So Medicare typically does not cover vision, dental, hearing, or long-term care. Some of the Medicare Advantage plans may cover that, and we'll go a little bit more into detail about that a little later on in the presentation. So what are the different parts of Medicare? You often may hear Medicare referred to as Medicare soup because there's so many different parts to it. So the first part we're going to cover is Part A, or your hospital insurance. Medicare Part A helps pay many of your expenses if you're admitted to an inpatient hospital that accepts Medicare. Some of those services may include a semi-private room and meals, nursing services, drug supplies and other hospital services, lab tests and x-rays, some blood transfusions, inpatient rehab services, and most hospital services for the first 60 days. Part A can also cover some other care in other settings, such as the first 20 days in a skilled nursing facility, such as a physical and occupational therapy after being hospitalized. But you do need to be hospitalized for at least 3 days or 3 nights. You might hear it as the 3 moons in order to qualify. And you have to be inpatient and not just for observation. Some part-time skilled home care for people who are homebound and hospice care. Part A does not cover any personal expenses such as TV or phone that are separately charged. A private room, unless it is the only room that's available or it is pertinent to one's care, and services you receive from a doctor while you are in the facility. Cost for 23, and something really important to note that all the costs that you see here will be for the year 2023. I know 2024 is quickly approaching upon us, and especially you're going to hear more about 2024 with open enrollment being right around the corner, but all these prices are still 2023. So typically there's no premium for Part A as long as you have your 40 work credits. And you typically get those 40 work credits within a 10-year time span. For example, I'm 29 and I already have my work credits in to receive Part A for free. The deductible for 2023 is $1,600 for days 1 through 60 of inpatient care, and there is a deductible that can be applied again for additional hospitalizations after the day 60. Part B is your medical. So these are going to be your doctor visits, your outpatient services, durable medical equipment like your walker or wheelchair, and Medicare-approved preventative services. Also your clinical labs such as blood and urine tests, CT scans, your diabetes care, and some of the, there are some prescriptions that you typically don't administer yourself that would be covered under Part B as well. Part B does not cover eye exam, eyeglasses, and most contact lenses, hearing aids, and exam for fitting them, dental exam, and cleaning. And the way that I like to remember Part A versus Part B, that if you put hospital and medical in alphabetical order, they align with Part A and Part B. So you have hospital, medical, A, B. So your cost for Part B in 2023 is the standard premium will be $164.90. And the reason why that is the standard premium, if you are a household of one or an individual, if you make more than 97, or a couple who makes more than 194,000, you will have to pay a higher premium for your Part B. And that is a 2-year look back. And if for some reason your income had changed quite a bit and you no longer are at that level, you can go to Social Security and file a claim and try to get those reduced. There is an annual deductible of $226 per year, and a co-insurance is typically 20% for most services. So if when you go to the doctor, you would pay 20% of your service. So your Medicare Advantage plans, you also might hear those referred to as Part C. And they're an alternative to original Medicare, but they have to cover everything that Part A and Part B covers. And these are by private insurance companies, and you may be eligible to purchase may limit your ability to purchase a Medigap or a supplemental plan in the future. And how a Medigap is structured, in this day and age, we often bundle our phone, our internet, our cable all into one plan. Think about is similar to a Medicare Advantage plan where you bundle your Part A and your Part B, which we've already talked about, and your Part D, which we'll talk about a little later on, which is your prescription drugs. And most of the time, those are all going to be bundled into one comprehensive plan. And these are going to be structured very similar to your employer-sponsored healthcare, where you're going to have your HMOs and your PPOs and have to deal with in and out of network. And it's really important to note that with original Medicare, you can go anywhere in the country that accepts a Medicare or accepts assignment, as you may also hear it referred to. But with the Medicare Advantage plan, since we have to deal with in and out of network, they are very regionally based. And so some areas in the country may have a whole lot of Medicare Advantage plans to choose from, and some may have very little plans to choose from. So it's really important to look to see what is available in your area. Make sure that your providers are still in network. And not only does that include your doctors, but it also includes your pharmacy, making sure that they're in network as well. And with the Medicare Advantage plans, they may have additional benefits like we were talking about earlier with the hearing, dental, and vision. And more additional benefits are being added every single day. For example, there may be some transportation services or home delivered meals that are a part of the Medicare Advantage plans. Part D are your prescription drug coverage. They help cover your medications, and they are run also by private insurance companies. What's really important to note about a Part D is that it is an optional plan. You do not have to actually pick up a Part D plan. But if you go uninsured and don't have anything to cover your Part D, then you will have to pay a penalty, and that penalty is 1% of the average plan. And this year, the plan is $33.34, I believe, or it's $33 and something. And so 1% of that for every month that you go uncovered. If you go years upon years without getting covered, that can really add up. I know I was assisting someone, I think probably back in 2018, who never signed up for a Part D plan. And so she had to pay a penalty for all of those months since Part D became a law under the Bush administration. She had to pay the penalty that entire time. So it's really important to sign up if you want your prescription drug coverage, either through a Part D or through a Medicare Advantage plan. So Part D, people enroll into Part D may pay monthly premium, co-payment, co-insurance, annual deductibles up to $505. And people with higher income may have to pay higher monthly premiums as well, just like with the Part B as in boy. So this little chart is a really great example of how original Medicare fits in with a Medicare Advantage plan and what your options you have. As we remember, Part A and Part B are your original Medicares, and you can opt in to getting a Part D plan as well, or you can decide to bundle that all together and get a nice little Medicare Advantage plan. With original Medicare, you can also pick up a Medigap or a supplemental plan as well. Like we were saying earlier, this is original Medicare. You can go to any provider that accepts Medicare. So when do employees enroll into Medicare? There are a few different options on when someone can sign up. You can sign up during your initial enrollment period, a special enrollment period, or during open enrollment period or a general enrollment period. So your initial enrollment period is when people are first become eligible for Medicare. So if your employees are receiving your Social Security, like we mentioned earlier, they will be automatically enrolled into Medicare at the age of 65. And they have a 7-month period to enroll. They have 3 months prior, the month of their birth, and 3 months after their birth. It's really important to note that if someone is born on the first of the month, then their birth month is not actually the month they were born, it's the month prior. There's also late enrollment penalty that you may have to pay if you don't enroll into Part B and Part D when you first become eligible during your initial enrollment period, if you don't have credible coverage. So special enrollment. So this is where maybe a lot of your employees may sign up at. For employees who do not enroll during when they're first eligible when they turn 65, this is when they will enroll. And it's also important to note that if someone does decide to delay enrollment into Medicare, making sure that they have all their paperwork proving that they had coverage during that time, because that may become a factor later on. So this period is available to people who are over the age of 65 and currently working and covered by their employer-sponsored health care. And employees lose their employer coverage either at the end of their employment or at the end of their coverage. And I know I've been seeing a couple of people ask if this recording will be sent out. Coming through in the chat, this recording will be sent out. So let's see, went the wrong way. So open enrollment, and this is where I'm going to focus a little bit more on this because open enrollment is upon us. Open enrollment is the same exact time every single year. It's October 15th through December 7th. And this is when a person can enroll into a different Medicare Advantage plan or a Part D plan. And they can really evaluate to ensure that the current coverage that they have is the coverage that they need. And so it's really important, even if you're happy with your plan, to look into all your different options. In September, an annual notice of change should be sent out from your current insurance companies telling you about any changes that will be made for this upcoming year. So it's really important for you to take a look at that letter, ensure that if you have a medication, making sure that the formulary hasn't changed. The formulary is just a list of prescriptions that are covered by that plan. Also, if a provider is in and out network, so it is really important to evaluate your current status, even if you are currently happy and you feel like you're getting a good deal. Also remember, all of these plans are very individualized. Just because your spouse may be enrolled in the plan doesn't mean that that's the plan for you to enroll. Just because your neighbor is enrolled in the plan doesn't mean that's the right plan for you to enroll in. So it's really important to look to see what all your options are. And once again, your open enrollment is October 15th through December 7th. So make sure that everyone that you know looks into their plan options for this upcoming year. And a little later on, we'll talk about really great resources that can help you navigate Medicare in general, but it will be a really great help during open enrollment. So penalties. Part A, you have a 10% increase for monthly premiums if you do not enroll when you're eligible to, or if you don't have credible coverage. And this penalty will last for twice the amount of time that you did not enroll. So if you went 1 year without enrolling, then your penalty will last you for 2 years. Now with Part B and Part D, both of these premiums will last for lifetime. So a Part B penalty is 10% of the monthly premium for every 12-month period you do not sign up. And the penalty will stick with you a lifetime. Whereas with Part D, as I was mentioning earlier, the national base premium is $32.72, and you have to pay 1% for every month that you go uncovered. So you can see where that would really add up. The great thing is, though, if you qualify for a Medicare savings program or extra help, which are some assistance programs to help lower your Medicare costs, then your penalties will be waived. Medicare and your business. So if you have fewer than 20 employees or a small business, eligible employees must enroll into Medicare. Once again, if you have fewer than 20 employees, they must enroll into Medicare. And Medicare becomes the primary insurance. And the work-based coverage will become the secondary. Now, if you have a large employer, then your eligible employee can choose if they would like to enroll into Medicare or not, and Medicare would become secondary. So if you have more than 20 employees, they have a little more flexibility and more options when it comes to their Medicare choices. So these are some of the breakdowns of what can happen for people in different employer settings. So in a smaller employer setting, they should enroll into Medicare Part A and Part B during their initial enrollment period. If they have a large employer, like we said, they have a little more flexibility, a little more options. They can enroll into Part A and Part B if they would like to, or they could just enroll in Part A, since Part A is free for most people, or they could just delay enrollments in Part A and Part B altogether until they decide to retire or the coverage ends, and they would then qualify for a special enrollment period. So initial enrollment education timeline. As we talked about earlier, when you turn 65, also if you become eligible due to a disability, you have a 7-month period of time that you can do it. You can enroll. So about 6 months out, you're gonna receive an overview letter. 3 months prior to your birth month, that's when your initial enrollment period starts, or 3 months prior to your start of Medicare due to a disability. And then that's when you're going to start getting some of your Medicare educational materials, like your Medicare and You book, which is a really thick book that gets sent out every year that has a lot of great Medicare information and also plan details as well. You will also receive your red, white, and blue Medicare card. You may remember several years back now, there was a big campaign to get everyone a new Medicare card because your Medicare number used to be your Social Security number. If that's what you knew previously, no need to worry. They are no longer your Social Security number, just a unique identifier. Then you have your birth month, and it's really important to have all your Medicare options by this time, right? You don't want to have any gaps or lapse of coverage. And then after 3 months after your birth month, that is when your initial enrollment period closes, and you should be enrolled or make a decision to delay your enrollment due to you still working. Engaging your employees on Medicare, make sure it's clear and consistent information and communication. Make sure you're up to date with the most relevant Medicare news. Some things, can change from year to year. We saw in the middle of the year, we had the price drop of insulin, making sure that your employees know all that type of information. Refer employees to trusted and reputable sources, which we're going to talk about a little later on, and educate employees about Medicare prior to eligibility. AARP is here to offer these type of trainings. The SHIP program, which we will talk about a little later on, or the State Health Insurance Assistance Program, they're another resource that can be used to help educate your employees. So resources. So a really great resource is Medicare.gov, or you can call 1-800-Medicare, or you can see the number there. Here you can create an account on Medicare.gov, and it will be all tailored to you. You can enter your medications, or they may pull your medications if you're already enrolled into Medicare, and they will and you can kind of look to see what your options are in your area. So you'll be able to pick your pharmacies that you want to go to. Make sure you can also see information about the plans, to go to the plan website, and make sure that your provider is in network, your doctors are all in network. It will also give you a price breakdown for every medication that you take per pharmacy. And what's really great about this is Medicare also has like preferred pharmacies, and you have your standard pharmacy. So making sure that you go to the right pharmacy can also help lower your costs. So this is a really great tool that you can use to help navigate your options and all your choices with Medicare. You can also look at your Medicare and You on here. You can look at your Medicare summary notice and all those different type of details. See how far you are into your deductible. Another trusted resource is the Medicare Rights Center, which is a nonprofit organization that ARP works with quite a bit, who answer some questions on our Your Questions Answered tool. And they have really great insights into Medicare. And another one is the SHIP program, or the State Health Insurance Assistance Program. And I will pass it on to Maggie to kind of talk about the SHIPs.
Sure. Thank you, Xavier. I'm happy to be here today to share with you all more information about the SHIPs. Thank you for turning the slide. But before we hop into that, I just wanted to give you some, background information on the Administration for Community Living. The Administration for Community Living, or ACL, is a division of the Department of Health and Human Services, and it manages the State Health Insurance Assistance Program, or SHIP, nationally. ACL was created around the fundamental principle that all people, regardless of age or disability, should be able to live independently and fully participate in their communities. So we use a person-centered approach to services, offering a range of community-based services through a network of state and local partners. ACL programs help older adults and people with disabilities find supports and services that they need in order to successfully live in their communities. Services such as Medicare education and counseling, like today's event, meals at home or in community centers, activities at senior centers, transportation and assistance with medication management are just a few samples of the services provided by our partners. So if you're interested, you can learn more at acl.gov. Next slide, please. Or I might have control. Sorry, I've realized we didn't talk about that. So the State Health Insurance Assistance Program is a community-based network of counselors who provide assistance in person, by phone, and virtually. They make group presentations and use a variety of media sources to educate people about Medicare. It's a national program that offers one-on-one assistance, counseling, and education, not only for beneficiaries, but also for their families and caregivers to help them make informed choices about their care and benefits. There are 54 SHIP grantees, one in all 50 states, Puerto Rico, Guam, the District of Columbia, and the U.S. Virgin Islands. And SHIP services are delivered typically by the State Unit on Aging or State Department of Insurance in partnership with their local area agencies on aging, also known as AAAs, and other community-based partners. Nationally, there's a network of more than 2,200 local sites with over 12,000 team members, including staff, in-kind professionals, and volunteers providing these services. In addition to SHIP services, many grantees also provide the Senior Medicare Patrol, or SMP program, and that looks at helping Medicare beneficiaries protect, detect, and report healthcare fraud, errors, and abuse. SHIP recruits and trains team members to provide services, which includes helping people obtain coverage through options such as Original Medicare, Medicare Advantage, Medicare prescription drug coverage, and Medicare supplements, all of the things Xavier just ran through. Next slide, please. I'd encourage you all, if you're interested in working with the SHIP in your community, to find the one in your state. You can do that by using the website here, shiphelp.org, or calling 877-839-2675. This will take you to the SHIP TA Center, which serves as a central source of information for the grantees, but also hosts the SHIP locator. So you go there, you'll find the SHIP in your state, and you'll be able to connect with them locally. One caveat, as Xavier mentioned, we are entering into open enrollment season, and this is their busiest season. So if you want help with open enrollment, I would call today. And if you want to partner in the future to help provide education for your employees, maybe call after December 7th. Thank you.
Also, another great resource is ARP. We have a lot of really great resources on our website, arp.org/Medicare. This on the website, you can find different articles written for different Medicare needs and wants. We also have materials that we can be sent out to your business. You can disseminate out to your employees. Also, a really great tool we have is the ARP Medicare Enrollment Guide, or you may hear it referred to as the MEG. There are two different situations that you can do. You can view your situation, or you can explore the guide. If you do the view your situation, it will ask you a few questions, and then at the very end, it will tell you what you need to know. So you can say, I'm about to turn 65, but I'm still working. I'm covered through myself or a spouse health insurance, and they'll tell you what your options are. If you feel like you need a little more guidance, or you want a little more detail about all the different parts of Medicare, go into more depth than what I did in this presentation, then you can go through explore the guide and go through a learning module that will take you step by step about everything that you need. Also, we have the arp.org/Medicare Employer online learning series that is really great to be a great service that can be used for you all as well. Conclusion, I know this was very quickly, but I know we have a lot of questions that came through the chat, so I want to make sure that we have a lot of time to answer your questions during this presentation. But these are your Medicare basic. You have your Part A and Part B, which are your original Medicare, which you can add on to and add a Part D prescription drug plan, or a supplement, or a Medigap plan, or you can also get it through a Medicare Advantage plan. Open enrollment is October 15th through December 7th, same time every year. And you can now know all these really great resources, whether it be Medicare.gov, the state health insurance assistance programs, or all the great Medicare Rights Center, or all the great resources hosted on the AARP website.
Well, Xavier, I mean, thank you so much. I know there's just so much wealth of information that you presented for folks on the line, because Medicare is just one of those things that I think a lot of people have to spend some time with to really understand. And we're already getting a number of different questions in there. And Maggie, thank you for highlighting the great work that ACL does and that the SHIBs do, because they're really such a great kind of state and local resource for folks. But I already see them piling in, so it's really exciting to hear from everyone. And we again thank the folks for joining. You know, one thing that I want to just cover, and I know Xavier talked about it, is the recording will be sent out. So, you know, I know there was a lot of information we went through quite quickly, so you'll be able to reference it and look at the slides and go from there. But I do want to kind of turn to some of the questions that we have here. One quick question from George is talking about eligibility and when folks need to sign up. So he asks, in the year the individual turns 65 and it's more than 7 months before the enrollment period begins, what can they do? So a little bit question about kind of special enrollment, initial enrollment, and open enrollment.
Yeah, so if you if your initial enrollment period hasn't started yet, the great thing that you can do, or one of the few things that you can do, is just start exploring your options. You can go in on Medicare.gov, see what plans are available to you in your area. You can plug in your medication. If you see a plan that you may like, if it's a Medicare Advantage plan, ensuring that all your providers are there in network, and just kind of start exploring to see what all the options are in your area. Talk to your employer, see if they don't maybe have a Medicare sponsor plan as well, and all those different type of things. So right now, you would just be in your learning phase or your exploring phase of things.
I'm always feel like I'm in my learning and exploring phase. So it's good. And having been doing this work for a while, I'm still learning more and more about Medicare. We got a question from Gretchen talking a little bit more about the different types of the different parts of Medicare, and particularly talking a little bit more about Medigap. And so I was wondering, Xavier, if you could kind of just hone in a little bit more on the different types they're in and where Medigap fits into coverage.
Yeah, so just like the name says, Medigap, or you may also hear supplemental, they help supplement or fill in the gaps that original Medicare has. You may recall that we talked about earlier that Part B, you're responsible for 20% of your part of your those expenses, right? So you may get a Medigap plan to help with that 20%. There are a lot of different plans you can choose from. I believe they go from A to N, and these are really important to note that these are plans, right? We have your Part A, your Part B, but with Medigap, they're plans and not parts. So don't get a Plan A or B confused with Part A and B. And so these can be great, another great alternative to a Medicare Advantage plan. It's just really thinking about what you can afford, because these plans can be a little more costlier than what a Medicare Advantage plan can be. And so it's just really important to kind of look and see what your healthcare needs are and what you can afford as well.
Yeah, makes sense. And then we have another question here from Robin. They're asking, is an employee on company insurance after 65? If an employee is on company insurance, there are less than 20 employees, they're a smaller company. After 65, can they get Medicare Advantage without penalty?
Okay. Sorry, I'm just rereading it myself to make sure that I answer correctly. So if you have less than 20 employees, then a person would have to sign up for Medicare. And it doesn't matter if you do original Medicare or a Medicare Advantage plan. So if you sign up when you're first eligible during your initial enrollment period, sign up for a Medicare Advantage plan, you will be fine.
And we see, I have a question from Pete in the chat asking, what about employees who are receiving VA healthcare? How does Veteran Affairs kind of interact with Medicare? And Maggie, I don't know if you want to take that either or jump in as the kind of ACL representative, but either or. So how does Medicare and VA benefits kind of coincide?
I'll let Xavier take it, because that is a tough one that confuses lots of people, including me.
Yes, as Maggie says, is much more complicated than what you would realize, right? Because when people talk about VA benefits, sometimes they use that as an umbrella term, right? So sometimes they're also talking about your TRICARE and TRICARE for life, and not just straight up VA benefits. And all of those have different requirements. So if you have, and Maggie, please correct me if I'm wrong, if you have the VA benefits, like truly VA benefits, you do not have to sign up for Medicare. But if you don't sign up for Medicare, you can only go to a VA hospital for all your services, and you wouldn't be able to, to go outside of the VA network. If you have TRICARE for life, then you do have to sign up for Medicare because that is not included as credible coverage.
Yeah, I believe that's right. And I chatted in a resource from the VA to make sure everybody has everything they need on that topic that walks you through how it works with Medicare and other types of insurance.
Then we got a question in the chat about a business that has less than 25 full-time employees, but they participate in a group healthcare plan that their employees are participating in. Their employees are in Medicare Part A, but also in their health plan. Do they still need to have a separate Part B they must enroll in? I think this is a question about kind of the small, less than 20 full-time employees. What are they going to need to do if they do participate in that group health plan? In essence, when is Medicare primary or secondary?
Yeah, so for a small employer, Medicare is primary. So it's really important. They have to be enrolled in Part A and B. And if they miss their initial enrollment period to sign up for it, from January through March is the general enrollment period, and they can sign up for their Part B. And that plan and your Part B will take effect the month after you sign up.
I think there's kind of a follow-up about, is it only Medicare Part A or Part A and B if you have less than 20? And I will say that there is a complication where if you do participate in kind of that group employer plan, and that group employer plan has large employers included in that plan, things do change. Is that right, Xavier?
Maggie, is that correct?
I honestly don't know. I don't want to
Okay.
misspeak.
Well, we can get you some more information
Yes.
afterwards, as well to make sure you have that. And then we do have some questions about penalties, and I was wondering, I know you covered it, Xavier, but if you could go in and talk about the penalties again, and kind of particularly the penalties that stick around for life. What are the ones that folks should be really thoughtful about avoiding?
Yes. And could we go back to that slide? I think that would be useful. Thank you, Colin. So I'll start with the part B as in boy penalty. That is 10% of the monthly premium. So right now, what is 164, right? So your penalty would be $16.40 some cents, and that would last you your entire life unless you qualify for a Medicare savings program or a Medicare savings program or the extra help program. And both of those programs are assistance programs to help lower your costs. So for extra help, which is a program administered through Social Security, they help with your prescription drug costs and things. Your Medicare savings program also has extra help built into it, but they also help with your Part B premium and some of the co-pays and everything that are associated with that. Your Part D is 1%, and this is the thing to note. Part B is for each 12-month period you go uncovered, right? Part D, as in drug, is every month that you go uncovered. So it's really important to note that distinction between the two. So if you go uncovered for 4 years, that 1% every month, that would add up, looking at the national base beneficiary premium, which is currently $32.74. So you can see where 1% over a 4-year period or for 48 months could really add up and be a substantial amount of money. So it's really important, even though Part D is optional, it's really important to sign up if you think you will ever need drug coverage at any point in your life. And it's also important to note, as we add more assistance programs like GoodRx and all those different type of things come into play, that those are not credible coverage. That is not a drug plan. Those are just assistance programs to help lower your costs. So if you try to get all your medication through that will not count as if you had a Part D plan or a Medicare Advantage plan that had drug coverage.
Great. And I was wondering, maybe we can go over this kind of determination here, as some folks have some questions about fewer than smaller 20 employees. And I will say, I think we'll follow up with some more information via email about the distinction of those employers that may be participating in a group healthcare plan with other employers, because there is a component there's a complication. So hold off there, and we'll follow up via email so you just have the resource. But I do want to just give Xavier a second to kind of go over this part again.
Yeah, so like I said, it's just really important to know how many employees someone has, or full-time employees. You have the 20 versus the more than 20, right? And those really impact your options when it comes to your Medicare. So if you have a small employer or the fewer than 20, then you have to enroll into Medicare, and it will be your primary insurance. If you have more than the 20, you have the options. And you remember on the slide next, the following slide after this, it kind of breaks down your different options if you have that larger employee, where you can enroll in Part A and Part B, or you can just enroll in your Part A, since we know that most people are going to have that Part A for free, right? So there's no harm in just enrolling in your Part A and then delaying your Part B. Or you can just delay your Part A and your Part B until you decide to retire, and then you would then qualify for a special enrollment period. But it's just really important, as I mentioned earlier, to make sure that you keep records of your coverage during that time when you delay your Part A and Part B, if that's what you decide to do. But 20 is your magic number.
Yep. Great. And then definitely seeing some questions about what is an FTE, and what does that mean? And it is full-time employer equivalent for that. There is some other pieces on part-time which we can send out as well afterwards, just so folks know. But I think that the real component here is, for your employees, they may not know the employer size. And so, particularly if you have that kind of under 20 and are not part of a group healthcare plan, helping your employees know that this is something that they need to be aware of, because they may not know that, the size of the FTEs that may fluctuate. All right. And then we got a final question here from Denise asking, can an employer offer a Medicare Advantage plan?
They can. Some employers do have Medicare Advantage plans that they offer. For example, my dad is on Medicare. He is a retiree of the state of Missouri. And so he gets his plan through the state of Missouri, and it's the Medicare Advantage plan. So yes, that can be an option if your organization offers. But it's important to note the rules that the organization has for those plans. So for example, if you feel like you're not happy with your employer-sponsored Medicare plan and you want to shop around, it's really important to understand is, if I leave this plan, are they going to allow me to come back to it if I don't like it, if I don't like what's offered through other insurance companies? So understanding that is really important, because some plans won't let you come back.
Oh, really helpful. And I know we've had lots of different questions. We're going to get some more information via email, so make sure you guys have the right resources. But Xavier, I do want to just invite you and Maggie to talk a little bit again, just remind folks of the resources available to them. I know we'll share the deck around and the links included in it, so folks can go to the Medicare Rights Center, can go to AARP's tools, but just wanted to kind of remind folks of the tools available to them for more questions, and then we'll follow up individually via email to make sure your questions are answered as well.
Yeah, so we have Medicare site, or their 1-800 number, and on Medicare you can create your own My Medicare account, and that way you can kind of see all your different options, and it will all be associated with your account. You can really break down the prices and see all the nitty-gritty details in there. We also have the Medicare Rights Center, which is a great resource, and we partner with frequently to answer some of your questions that you have on the AARP website. And also we have really great articles on there that you can that are also linked to our Medicare enrollment guide. And so if you're new to Medicare, it's a really great resource to kind of navigate your way through that. And I'll let Maggie talk about the SHIPs and S&Ps.
Yeah, excuse me. So y'all are asking really great, complicated questions, and the SHIPs are really good resources for you, especially when it comes to Medigaps as well, because those are state specific. So they're familiar with the plans in your area, the ins and outs of Medicare. So they're really a wonderful resource. So I'll chat in that website again for you all. And outside of the open enrollment period, though they may be available now to help, they can come and give presentations to your employees and really help answer those personalized questions people may have.
Awesome. And thanks, Maggie, for letting everybody see that. And thank you, Xavier, for all the information. Well, any kind of final thought, any thoughts or comments before we close out?
I hope everyone has a great open enrollment, and may the formulary be in your favor. And if you have any questions, just feel free to reach out, and we'll be more than happy to assist you.
Awesome. Well, thank you all for the time today. We really appreciate it. And we'll be in touch via email with more resources, information. And again, do not hesitate to reach out to Xavier. We'll make sure his contact information is included there, any of the resources available to you, or reach out to the SHIPs as Maggie indicated. So thank you all. I know there's a lot of information thrown in there, so we really appreciate you joining today. And again, I hope everyone has a great rest of your week. And this is now the official end of the webinar. Thank you.